David Kleiman here with the EMS Operations Division. Today I'm going to be talking to you about Versed. Our Versed dose used to come in 5 milligrams of Versed into 2 milliliters of a saline solution. 5 milligrams into 2 mLs of saline. So that ended up being a concentration of 2.5 milligrams per 1 ml of a saline solution. Now, due to supply chain issues, we are getting 5 milligrams of Versed in 5 mLs of a saline solution. 5 milligrams in a 5 ml saline solution, which actually comes out to a better concentration of 1 milligram per 1 ml of a saline solution. We'll be going through some pediatrics, and you'll actually see on the examples how it's an easier concentration for us in drawing up this medication. We'll also be going over different types of intermuscular sites and what's the max dose that you can give per muscle site. Remember, 5 milligrams into 5 mLs, some of these muscles cannot handle a 5 milliliter concentration into that muscle group, particularly the deltoid, so we're going to have to go to different muscle groups. So now that we've gone over the new amount of cc's, the concentration, the 5 milligrams into 5 mLs, what we're going to do is a refresher on the intermuscular sites where we're going to give our injections. Remember, now that we have 5 mLs, a lot of muscle tissues have a certain amount of max that can go in each of that muscle tissue, so you're going to have to now start looking at alternate sites other than deltoid muscle for all the medication uses. First one we're going to go over is your deltoid injection site. Remember, we're trying to get somewhere in the triangle on our deltoid. Remember your max. The max is 0.5 to 1.0 mLs for a pediatric per deltoid, and for an adult it's 0.5 to 2.0 mLs for adults, and that's that max in the deltoid. The next is the ventrogluteal, which is your hip muscle. This is an alternate site for adults. It's going to be the max is 2.5 to 5.0 mLs for the adults. For adult and pediatrics, you can do the rectus femoralis or the vastus lateralis or your mid-thigh, lateral thigh. For the adults and pediatrics, it's 5.0 mLs. For the pediatric, this is your preferred site, either one of them, one of the two sites, for us giving a large dose medication. And for pediatrics and adults, remember, it's 0.5 to 1 mLs per nair. So remember to split your medication between both nair if you're giving intranasal medication. And the last thing we want to talk about is the Z-Track method. Remember, when we're giving a medication intramuscular, we should be pulling back the skin, inserting the needle. Remember, we're looking at least a 23 to 25 gauge 1-inch needle. And then as you inject the medication, you release the tension on the skin, and that will actually cause a Z pattern as you pull the needle out so the medication doesn't leak out. So if I'm going to give an intramuscular medication, I would pull back the skin taut. I like to do the dart method. I like to put my hand down, I push in the needle, pull back, no blood return, administer my medication, release the tension on the skin, pull my needle out, remember to make it needleless, sharps container, and now I have caused a Z-track so the medication doesn't leak out. All right, so now we're going to go over some examples of the medication and how we're going to draw it up. Remember, it's 5 milligrams in 5 mLs. 5 milligrams in 5 mLs, which comes out to 1 milligram per 1 ml. So for the example, we have a 2 kilogram or a premature pediatric patient. Remember, our protocol is on the seizures 0.1 milligrams per kilogram with a max of 5 milligrams. So in this case, we're going to be drawing up 0.2 milligrams, which is 0.2 mLs, 0.2 mLs, if drawn up in a 1 cc syringe. So in this case, we would take a 1 cc syringe. Remember, your needle is already attached for the IM administration because it's a 25 gauge needle. But as we draw up the medication, we're going to want a blunt needle. So I would, keeping everything sterile, I would put my blunt needle on, keep this needle where you can get back to it. I've got a 1 cc syringe. I'm going to be drawing it up to 0.2 mLs because it's 0.2 milligrams and it's 1 milligram per ml. I pull back my amount of air to 0.2 mLs. I'm going to insert my blunt needle into the medication, inject my air, pull up to 0.2 mLs. Remove my blunt needle, go to my IM needle, and now I'm ready to administer 0.2 milligrams or 0.2 mLs to this 2 kilogram seizing pediatric patient. So example number 2 we're going to go over. Let's say we have a 10 kilogram or a 1-year-old pediatric patient who's seizing. 10 kilogram. Remember, it's 0.1 milligrams per kilogram with a max of 5 milligrams. Remember our concentration, 5 milligrams, 5 mLs, which is 1 milligram per 1 ml. In this case, we're going to give the pediatric 1.0 milligrams or 1.0 mLs. So we can either draw up 1 milliliter in a 1 milliliter syringe, or in our 3 cc syringe, we can draw up 1 milliliter. So let's say in this case, we're going to use a 3 cc syringe. So I would open up my 3 cc syringe. Remember, it's already got the appropriate needle for intramuscular use. Remember, we're going to be using a blunt needle to draw up our medication. So I would open up my blunt needle, keeping it all sterile, pull over my blunt needle. I'm using a 3 cc syringe, so I would draw up 1 ml worth of air. I would go to my Versed, open it up, take my blunt needle out, insert it into the Versed, administer 1 ml out of that 3 cc syringe, and I would draw up 1 ml of the medication. Making sure to remove any air bubbles. Put on my needle for intramuscular use. 1 ml out of a 3 cc syringe. So our last pediatric example, let's say we have a 3-year-old. A 3-year-old is 15 kilograms. So we have a 3-year-old pediatric patient who weighs 15 kilograms who's seizing. Remember, it's 0.1 milligram per kilogram with a max of 5 milligrams for that patient. So in this case, remember, it's 1 milligram per 1 ml of our Versed now. We need 1.5 milligrams, which comes out to 1.5 mLs. In this case, we will be using that 3 cc syringe to draw up 1.5 mLs, which is equal to 1.5 milligrams. So once again, I would pull up my 3 cc syringe that has the appropriate needle for IM. I would pull up my blunt needle, keeping it sterile. I would open up my Versed. I would draw back to 1.5 mLs. Insert it into my Versed. Inject 1.5 mLs of air to pull up 1.5 mLs of the medication, removing all your air bubbles. Now I'm set up for my intramuscular use. 1.5 mLs, which is equal to 1.5 milligrams. Remember your concentration, 5 milligrams into 5 mLs, which is 1 milligram per 1 ml. Don't forget, sharps after all your needles come off. All right, so we're going to show you an adult example. So remember, for our adults, for seizure, it's 2.5 to 5.0 milligrams, and that's intranasally, intravascular IO or IM medication. Remember, we're going to draw up 2.5 milligrams, which equals 2.5 mLs. And remember, 1 milligram per 1 mLs. 5 milligrams, 5 mLs. 1 milligram per 1 ml. So in this case, if I'm given 2.5 milligrams, I'm going to draw up 2.5 mLs in a 3 cc syringe. If I happen to draw up 5 milligrams, I'm going to do 5.0 mLs in a 10 ml syringe. Just remember, any medication intramuscular, we do not dilute it. I'm going to show you how to draw up 2.5 mLs in a 3 ml syringe, and then I'll go over how to do it IV, intravascular, in a moment. So in this case, I'm going to draw up 2.5 mLs. I would get my 3 cc syringe. I would get my blunt needle, once again opening it up, put my blunt needle on. I'm giving 2.5 mLs. I'm going to draw up 2.5 of air. I'm going to get my medication, pull off my blunt needle, inject my 2.5 mLs of air, draw up 2.5 mLs of the medication, making sure I remove all the air. Sharps container. Now I've drawn up 2.5 mLs or 2.5 milligrams of the Versed. So remember, on any type of our seizure patients or our cardioversion patients, the dose is still the same. It's going to be on seizure 2.5 milligrams to 5.0 milligrams. On intravascular or IO, the concentration is still the same, 5 milligrams and 5 mLs or 1 milligram per 1 ml. In this case, let's say we're going to give the patient 2.5 milligrams, or if we're going to give 5 milligrams, if it's intravascular or IO, Dr. Nix wants it diluted, a 1 milligram to 1 ml. So there's two different ways you can do this. So let's say I'm taking my 10 cc syringe, and we'll start off with the 2.5 first. What you would do is pull out your 10 cc syringe. We're going to need our needle, if we're going to be doing it through an actual port, and our blunt needle when we're drawing up the medication. So I'm going to put my blunt needle on. I'm going to pull up, in this case, 2.5, which is right there. I'm going to pull up my medication, inject my air, now, let's say 1 milligram per 1 ml to dilution rate. Now what I would do is draw my syringe back to 5 mLs. Make sure you get rid of all your bubbles. I'm going to inject with my blunt needle into this rubber port. I'm going to inject 2.5 mLs of air, pull back my syringe to 5 mLs, and I'm looking at a 1 milligram per 1 ml concentration that I can go IV. So the second way we can do this, if we happen to be drawing up 5.0 mLs of that 5 milligram, you can take a 10 cc flush, open up your blunt needle, and I've got 10 cc's of flush here. What you're going to do, get your air bubble out first, get rid of 5 mLs of fluid, take your Versed, draw back your 5 mLs, put your blunt needle into your Versed, inject the 5 mLs, And now I have done a 1-to-1 dilution. I've got 5 milligrams, which is 5 cc's, and I got 5 cc's of a flush. So now I'm back to my concentration. Remember, 1 milligram per 1 ml dilution here. So 5 milligrams and 10 cc's is how Dr. Nix wants to be given slowly over 2 minutes. If you have any other further questions or need additional training, contact the EMS Operations Division.